You're listening to Fast Facts, Ask the Expert with Machell Hudson-Hoover.
Hello, friends. Machell here, and this is Mental Health Awareness Month. And today we're going to highlight the powerful connection between mental health, systemic inflammation, and oral health. Let's explore how stress, mental health challenges can significantly impact oral and overall well-being, and what we can do to help our patients. Today is dedicated to my nephew, who our family lost 5 years ago to suicide. Anyone who has had this happen within their family, my heart goes out to you. I love you, and I hope no one has to go through this ever. Unfortunately, it will happen, and the more prepared we can be, there is opportunity for us to save and change lives. So let's talk a little bit about statistics. We know mental health in the United States, 1 in 5 adults experience mental illness annually. Y'all, that's over 50 million people. On any given day, 40% of adolescents deal with diagnosable mental health challenges such as anxiety or depression. And I'm in this demographic. Menopausal women face higher rates of anxiety and depression, along with one of the highest suicide risk in the U.S. And I can tell you, if I didn't have such a great integrative hormone physician, I would have already pulled out all of my hair. My anxiety was through the roof this past April, or a year ago, April. And I was at a loss, and I found an excellent integrative hormone doctor, and it took about a month, and I have no anxiety now. So there is help out there. We just have to help our patients and ourselves find the appropriate help. Oral health challenges for those with mental health disorders. So we know individuals with poor mental health are more likely to experience periodontal disease, caries disease, xerostomia, which is only further going to lead to an increase in inflammation, both orally and systemically. Nearly 70% of individuals with poor mental health report unmet oral health needs. So let's talk about the inflammatory impact of stress, how inflammation develops. So we know that stress triggers the release of cortisol and pro-inflammatory cytokines. We know that these inflammatory markers are going to weaken the immune system, reducing the body's ability to fight infections such as periodontal disease and caries disease. Chronic stress can also lead to xerostomia, increasing the risk for caries disease and worsening the oral microbiome's balance. Oral and systemic connections. We know that periodontal disease contributes to systemic inflammation by releasing harmful bacteria and inflammatory mediators into the bloodstream. This is going to further exacerbate conditions such as cardiovascular disease, diabetes, mental health disorders, creating a vicious cycle of poor health. How can we advocate for our patients? We can be a supportive advocate. Let's start there. Recognizing the signs of mental health struggles such as neglected oral hygiene or withdrawn demeanor, and refer patients to mental health professionals when needed. For our perimenopause patients, consider referring to an integrative hormone specialist to address underlying hormone imbalances. And actionable strategies for reducing inflammation. Simplify their oral care routines. Introduce tools like electric toothbrushes, interdental picks that simply simplify their hygiene without overwhelming the patient. Meet them where they're at. Recommending xylitol gum, mints, probiotics for oral health and systemic health. pH alkaline products are going to be really beneficial, especially for those taking medication or especially for patients suffering from xerostomia. Promote anti-inflammatory diet, of course, coming in very sensitive, encouraging patients to incorporate whole foods nutrition, omega-3 fatty acids to combat the systemic inflammation is going to be helpful, encouraging them to hydrate with water, not fluids with added sugars and chemicals. There is no pressure to change, but encourage them to avoid foods that feed inflammatory processes, such as as added sugars and ultra-processed foods, and support their stress reduction, advocate for manageable stress-reducing practices like mindfulness, deep breathing, activity, being outside in the sunshine. Mental health and stress are not isolated from oral health. They are deeply connected through inflammatory pathways. A dental professional can help their patient. Monitoring and managing inflammation with more frequent recalls is going to be helpful. Educating patients on oral systemic connection and how reducing stress and tailor their care programs. Our dental teams have an opportunity to show compassion and show that we can be the change for our struggling patients in need. Thank you so much for listening to this podcast, and I hope you have a great month.
You can reach out to me, Machell, at rdhhealth. You can also find me on LinkedIn, Instagram, and Facebook. Machell Hudson-Hoover.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you would like one of our experts to answer, simply email me, Andrew, at ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.